today's procedure. This presentation is from the Euro Observational Research Program, and it's entitled the Atrial Fibrillation Ablation Pilot Registry, and it's led by the Hospital Clinic of Barcelona, and it's Dr. Elena ARBELO who's going to be presenting.
Good morning, ladies and gentlemen. I'm very glad to share with you the first year follow-up results of the atrial fibrillation ablation pilot study. This is the first the first prospective, multi-center and international registry to really tackle the real-life current clinical practice in the ablation of atrial fibrillation across Europe. The primary endpoint of this registry was to describe the clinical epidemiology of patients undergoing this procedure and the diagnostic and therapeutic processes applied to them. Specifically, we also evaluated how centers were assessing the success of the procedure and the acute and one-year outcomes of the procedure in terms of recurrence rate and complications. Finally, we wanted to evaluate how the recommendations of the clinical guidelines and the expert consensus were applied in a real-life setting. This diagram shows the center distribution across the 10 different European countries that participated in the registry. These were 72 centers that included 20 consecutive patients during 1 year. All the data was randomly validated by local monitoring in 6 different countries of the 10, and therefore there's some kind of minor auditing of the data. The centers that were selected were medium to high expertise centers with a minimum number of ablation of 50 ablations, atrial fibrillation ablations per year, and a median number of 180. So, from an initial cohort of 1,410 patients, these were patients that were obviously different to the general population of atrial fibrillation. They were younger, the median age was 60 years old, and they had a lone atrial fibrillation, that is no structural heart disease, in 40% of patients. And also, as has been seen in other areas of cardiology, women were significantly underrepresented. They were only a third of the population. They had 2/3 of the population were underwent the procedure for symptomatic paroxysmal atrial fibrillation. As I just said, the main indication in 19% of patients was symptoms. However, up to a third of patients preferred to have a drug-free lifestyle. So, of the 1,390 patients that were discharged, we obtained follow-up from 1,300. We lost only 6% of patients to follow-up. And there were no difference in any of the clinical or procedural characteristics of the patients that were lost to follow-up and the ones that finished the 1 year period of follow-up. As you can see in these slides, atrial fibrillation ablation reduced significantly the symptomatology of patients undergoing the procedure. The main symptoms, both at baseline and at follow-up, were palpitations, fatigue, and dyspnea. And these were all significantly reduced. When we look at the treatment that the patients were taking at 1 year follow-up, we see that overall we had 65% of patients that were still taking oral some kind of anticoagulation, and 32% of patients were taking antiarrhythmic drugs. One surprising finding was to see that when one analyzed the risk of cardioembolic events, as much as 50% of the population with very low risk were still taking anticoagulants at 12 months. On the contrary, 20 to 25% of patients with high risk of cardioembolic events were not taking any anticoagulation. With regards to the results of the procedure, we see that 333 patients, that is 26% of patients, experienced some kind of recurrence, and there were 4 deaths during follow-up. So the procedure was considered to have failed in 26% of patients. 944 patients, on the contrary, showed no documented arrhythmia during the follow-up after a 3-month blanking period. Therefore, the procedure was considered successful in 74% of patients. As you can see on this graph, patients had a better outcome in paroxysmal AF as compared to non-paroxysmal forms of this arrhythmia. When we looked at complications, at the 12 month, during the follow-up, the occurrence of complications was low, only 2.6%, mainly in the form of cerebrovascular events and vascular injuries, mainly due to redo procedures, which, by the way, occurred in 18% of patients. However, if one takes into account the in-hospital phase, the peri-procedural risk is 7.7%, of which major was considered to be 1.7. Therefore, the complication rate, although low, is not negligible and should be really outweighed to the potential benefits of the ablation. Finally, the mortality of catheter ablation was 5 patients died overall, 1 in the in-hospital phase due to cardiovascular reason, an infective endocarditis in a patient with a pacemaker, and 4 during the follow-up, 2 in the blanking period, that is the first 3 months, and other 2 later. 1 of them was due to an hemorrhagic stroke 2 days after discharge, probably related to the bridging therapy between unfractionated vitamin K antagonist, low molecular heparin, unfractionated heparin during the procedure, and then going back to oral anticoagulants. So, in general, this is a summary. I'm only going to say that the main take-home message probably is that the procedure was successful, although 32% of patients were still taking antiarrhythmic drugs. Complications were low but not negligible, and there is a clear gap between the recommendations and the current clinical practice that should be considered in the future. Thank you very much.